EMDR therapy is a wonderful, robust type of therapy to use with children and teens. I use it with my kid clients all the time. Hi, I'm Jackie Flynn. I'm a certified EMDR therapist, a registered play therapist, and an EMDR-approved consultant. I teach EMDR trained clinicians how to integrate play therapy techniques into their EMDR work. EMDR therapy stands for eye movement desensitization and reprocessing. When a child or a teen goes through like a distressing or disturbing event in their life, we call it a trauma. A capital T trauma or lowercase t trauma, the big things and the smaller things. It can really have a big impact on how they approach the world. They can experience flashbacks, they may exhibit behavior issues, they could have excessive fears, it could show up as sleep problems, relationship struggles, just excessive sadness. It can make a big difference in their lives and the lives of those around them. Trauma stores itself deeply in the brain. So some of these behaviors or flashbacks, sometimes kids experience sleep problems, they may experience relationship struggles. They occur and they may not have an identifiable source. It may look on the surface like they're just acting out when really it's a trigger response to whatever it is that's happening to them. So with trauma comes lots of emotions and images, sometimes just felt sensations in their body, just out of proportionate responses to situations that you think they would respond maybe this big and they respond this big. EMDR therapy can help reprocess that all. It brings the information that is stored in the brain to the working memory. And as we stimulate both hemispheres of the brain in a rhythmic fashion, the right and the left, whether it's through eye movements or through tactile means or even audio means where they have headphones on or hear some kind of instrument on either side, then it can reprocess in the brain. Things start to lose their emotional charge. Things start to not be as upsetting, and they think and feel differently about situations than they did before. A lot of the kids that I work with, they start to sleep through the night. They start to have the courage to enter into social situations. They get their motivation back. They lose a lot of their behavior issues to where they can function better. It is amazing how it works. Over the years, I've successfully used EMDR therapy with many of my children and teen clients on issues such as bullying, some that may have been a victim of a natural disaster or an accident, maybe a witness or part of a violent crime. Some of my clients have struggled with eating disorders, and we've used EMDR therapy to really help with that, or body-focused repetitive behaviors. Many of my clients over the years have experienced a divorce or just a big family change in their family. So EMDR therapy has a seemingly endless amount of applications. It can help people get their lives back. EMDR therapy has 8 phases to it. The first phase is history taking and treatment planning. The second phase is preparation. The third is assessment. The fourth one is desensitization. And the fifth one, installation. The sixth one is a body scan. The seventh one is just closing out the sessions. And the eighth one is coming back and just reevaluating everything. With kids, it follows all 8 of those phases, but it may look and feel a little bit different because it's delivered in a developmentally appropriate way. It's super cool how it works with kids. The first phase in history taking, the clinician just gathers information from a multitude of sources to get a real good, clear picture of what the child has been through, their resources, just get a lot of information. And in the second phase, they really work to prepare the child for EMDR therapy. Now, for adults, they have many years of adaptive information in many cases. But for kids, we have to build up that adaptive information. We may need to teach them just ways to calm their body and prepare them for what the rest of the therapy looks like. Teach them how to go to their calm place in their mind or contain any overwhelming situations. And then once they are fully prepared and ready, the clinician moves towards the assessment phase. And when your child is in the assessment phase, the clinician's going to just pick out some targets to work on, some areas that we just really need to focus on and desensitize and reprocess. So imagine if your child is having nightmares and they watched a movie that scared them. They would target that movie or what images or felt sensations or thoughts about themselves that goes with that. It may be a specific image from the movie. It may be a memory that it reminds them of. There may be this feeling of I'm not safe or I'm going to die. And they may feel really scared in their body, real tight sensations in their chest or a stomach ache, something like that. So they pick out their targets in phase 3, and then the next phase, phase 4, they desensitize it. And that's really a cool part of the process. Stimulating the right and the left side of the body. We could do that through eye movements or auditory means like through sound, or tactile through some type of touch. We have these buzzers that they hold that alternates right and then left, right and left. Kids seem to love them. By doing that, the images and just the memory loses its emotional charge, and they start to see and feel differently about the situation than they did before. And then once that level of disturbance, we call it a SUD, the subjective unit of distress, when that is lowered, then we can then look into seeing how true that positive thought about themselves is that we want to install. So suppose that example of the nightmare because the child watched a movie that was really scary for them, that I'm not safe or I'm going to die. That positive thought may be I am safe or I'm fine right now. Something like that can really make a big difference, and they feel it in their body. It's not in any way trying to convince them that it's true or to lecture them. It's their brain working through the situation. Through EMDR therapy, their brain actually heals. You can see the difference on brain scans. And then after that positive thought about themselves is really associated strongly with the memory, then the therapist will have the child or the teen just scan their body. Just notice any tight, any tense, any unusual sensations, because a lot of times things can be stored in the body that don't have any words. So they can get the residuals, we call them dust bunnies, out, and then they can close out the session. And that's just bringing the kid back to a state of emotional equilibrium so they can go on with their day, with their life in a calmer fashion. Then after they leave, of course, sometimes reprocessing still continues. So they may come up with thoughts or something new may be connected. So the clinician in the next session will just reevaluate that target and see how it's going and work on the next one if appropriate, or finish up with that one. It's super cool how it works. It raises the quality of life. And EMDR therapy is just a wonderful type of therapy to use with children and adolescents.